National capital, Delhi, Ghaziabad, Noida and Gurugram. Look at the visuals. That shows you the gravity of the situation, the toxic air that the people of the national capital are breathing. Many people are saying that they're not able to breathe at all in Delhi. Now, the situation in the national capital is no longer just a pollution crisis. This is an air emergency. Some are even calling this an air apocalypse. And the numbers today are backing that fear. Delhi air quality has hit the 431 mark. It is dangerously close to the 500 mark, the very edge of the air quality scale. Now, that means that you and I are breathing air that is very dangerous, that directly damages the health of even otherwise healthy people in the national capital. The air that you and I are breathing is the worst of the season. So if you're living in the national capital, breathe at your own risk, because you are no more living in the national capital. This is a gas chamber. To understand the gravity of the situation, take a look at these ground reports from the national capital and listen in to the voices of the people of Delhi.
With the air quality index in Delhi reaching to 400, which is in severe category, the hazardous category, the GRAP 4 recommendations have been invoked in Delhi. And look at these visuals. The visibility has come down, and what we see is that people in Delhi-NCR will have to inhale this toxic air. Now, this is smog, and the smoke combined to form smog, which has engulfed Delhi-NCR. And every year is the same story here in Delhi. Now, our politicians continue in indulging in blame game, blaming each other over the mess. But in the end, people in Delhi-NCR will have to inhale such toxic air. Look at these visuals over here. This is not just smog. This is not just fog. This is also smog, which has engulfed the whole area. The visibility has taken a hit, and these are the visuals from the expressway, which goes from Noida towards Delhi. The situation in Delhi is reaching to the alarming stage. GRAP 4 recommendations have been invoked. But the question is, will we see a constructive debate by our parliamentarians in the parliament, and will we ever get a solution to the mess of this pollution, given the fact that how from past many years people in Delhi-NCR, specifically in winter, have to inhale this toxic air.
As the temperature is dropping down, also the level of pollution is rising in national capital. Here we are at this India Gate, where you will see the layer and the combination of smog and fog has leveled up to different difficulties in visibility as well. The visuals out here will show you that here at India Gate, very less visibility can also be seen. Similarly, people are rarely wearing their masks. Most of them are tourists, and of course guidelines are something that is yet not being followed. On the other side is the lane that leads you to Rashtrapati Bhavan, but through the lenses, through the camera or through the open eye, one cannot find out what remains or what stays on the other side of the road. Whereas now when we talk about the city's AQI data by the Central Pollution Control Board, then it is under the severe category with 459 AQI. Here I'll take you through the numbers of AQI at different localities in Delhi. Whereas Anand Vihar stands at 491, Ashok Vihar stands as 493, Chandni Chowk with 454, Burari 468, Dwarka 454 again. And here there are most of the areas like Munka, that is 485, Nehru Nagar 480, and Rohini is 499, which has now entered close to hazardous category. The way negligence is taking place, it is also more alarming how people will be facing the causes and the effects of pollution that will impact their health overall. With Rajesh Sharma, Shivani Mishra reporting for Times Now from
दिल्ली एनसीआर में प्रदूषण स्तर एक बार फिर से गंभीर स्थिति में आ गया है। एयर क्वालिटी इंडेक्स 441 दर्ज किया गया है, जिसके बाद CAQM ने तुरंत ग्रेडेड रिस्पांस एक्शन प्लान का स्टेज 4 लागू कर दिया है। ग्रेप के चौथे चरण में दिल्ली एनसीआर में सबसे सख्त प्रतिबंध लागू किए गए हैं। इस चरण के तहत जरूरी चीजें, आवश्यक सेवाओं को ले जाने वाले ट्रक को छोड़कर दिल्ली में ट्रकों की एंट्री बैन रहेगी। हालांकि CNG, LNG और इलेक्ट्रॉनिक और BS6 डीजल ट्रकों को इजाजत दी गई है। वहीं स्कूल और गवर्नमेंट ऑफिशियल्स को हाइब्रिड मोड पे आने को कहा है। गवर्नमेंट ऑफिशियल्स 50-50 की कैपेसिटी में आएंगे। उनको कहा है कि पूरी अटेंडेंस होनी चाहिए, पर 50-50 की करके अटेंडेंस उनकी दर्ज होगी। अब देखना ये होगा कि ये ग्रेडेड जो ग्रैप जो लागू किया गया है, इससे किस तरीके से दिल्ली में रहने वालों को थोड़ा रिलीफ महसूस होगा। कैमरामैन वसीम जी के साथ शफाली निगम, नव भारत टाइम्स।
We showed you the ground reports from the national capital. Let's now get you an overall perspective about how it is going to affect your health if you're breathing this toxic air in the national capital. For more on this, I'm joined by Dr. Vikas Maurya, Senior Director and HOD at Fortis Hospital here in Delhi, and Jaydar Gupta, founder Nirvana Being. Thanks so much for connecting with Times Now. Coming to you, Dr. Vikas, first. Now, people of the national capital are saying that they're not able to breathe. Even I have a mild headache, and I know this is because of the pollution in the national capital. So for the clarity of our viewers, could you tell us what really happens to the human body once they start breathing such toxic air, and once the AQI also crosses the 400 mark, as it has happened in the national capital?
Yeah, thank you for having me. So what happens is that whenever there is an increase in the pollution, which is now a regular feature in our capital cities and most of the metro cities, so this air pollution contains gases as well as pollutants like PM 2.5, PM 10, and these are very, very fine particles. And when you inhale, obviously you can't stop breathing, so you inhale and these goes into your lungs, and from the lungs they can also get absorbed, and from the blood vessels they can go to your entire body. Then again, these gases also get absorbed, and they also have effect on your respiratory system prior to they get absorbed, and they can affect your respiratory health as well as your overall body health. So what we see is that when there's an increase in these pollutants and gases containing sulfur dioxide, nitrogen dioxide, carbon monoxides, so all these gases and these pollutants, they affect the lung acutely as well as for a long period of time. So acute effects which we normally see is, the irritation, throat irritation, the lung irritation, persistent cough. They can also cause acute decrease in the lung function, and can also have upper respiratory infection, nasal irritation, eye irritations, eye watering, and then have lower respiratory tract infections, pneumonias. So these are the majority of the acute effects which we see predominantly more in elderly as well as in children. In children, because they respire more, their surface area of the lung is more, so they more absorbs, and they elderly have the lower immunity because their lungs are aging, and so they have more effects. But now with this increase in the air AQI level, even the healthy individuals, they also get affected, and they have all these symptoms as well. And also those patients who are allergic, who have hypersensitive airways, they have more problems, which I have already told right now. So all these people get affected, and in the long term, which we have seen, which the studies have shown, that they can also affect your cardiovascular health, can even have heart attacks, can even have strokes, and also have your neurological impact like dementia, and also effects on the pregnant women and their fetus as well. So the increase in the air quality, increase in the AQI levels, it does causes harmful effects, not only the short-term effects, but also the long-term effects as well.
Absolutely, and the government has also issued an advisory asking people to not step out, and if they have to, then they must consult doctor if they feel unwell. That is the situation there in the national capital. But before I come to you, Mr. Sridhar Gupta, let me tell the viewers, where does the national capital stand globally? Let us give you details as far as Delhi's AQI is concerned. It is nearing 500 mark. There are places across the national capital where the AQI has touched the 492 mark as well. That is in a dangerous category. Let's talk about China now. Remember, they have been able to control pollution over the last few years. Right now, the AQI there is between 80 to 120. That is still unhealthy, but not as dangerous as India. Let's tell you about Pakistan, our neighbor, 200 to 300. That is in a severe category. Let's tell you about London now, 20 to 30. which is in a good category, and also in Tokyo, where it is between 15 to 25, again in good category, and Paris, where it is again in 25 to 30 category, which is in good category. But look at India. Today, the situation is getting worse because we're learning that it has crossed the 500 mark as well. So for more on this, let me once again go across to Jayadar Gupta, founder of Nirvana Being. Thank you so much, sir, for connecting with Times Now. Several measures have been taken by the government in the last few days, and that includes banning the construction and demolition in the national capital, work from home, 50% of the strength at the offices. Do you think that is enough? Because we see it happening over years. Every year we see GRAP 4 is imposed when, the AQI crosses the 400 mark. Nothing really changes years after years. Do you think this year is enough?
Look, since October 19th, Akanksha, we've been in a state of emergency. This is not just increase in exposure. This is long-term exposure, okay? Let me be very clear. The quality of our bread today determines how long and how well we live tomorrow, okay? So this is serious stuff, especially for children. Even people like me, I'm a pollution refugee. I have bronchial asthma. I think Dr. Vikas will understand. Out of the 150 days of winter in Delhi, I'm probably in Delhi less than 100 days. I don't have an option. I have to run away. I have to follow predictors and see what's coming. We don't need a debate in Parliament on a health emergency. There was no debate in Parliament for COVID. We know very clearly COVID in 3 years killed 5 lakh people, and air pollution kills 20 lakh people every year in India. We don't need a debate in Parliament. This was such a perfect opportunity. Firstly, I want to congratulate the new government in Delhi for actually having the guts to step into GRAP 4, because we've seen like huge resistance. They made it so bloody political. They don't want to look as bad as the earlier government and whatnot. I want to congratulate them for actually doing the right thing and pushing Delhi into GRAP 4. But I think we need a GRAP 5. I think we need a lockdown. The city needs to shut down. There are so many Christmas markets and melas. My own school, modern school, is having a fate. I don't think people are, I don't think in the absence of health advisories, in the absence of a mask advisory, I don't think the city understands what it even means to be in a GRAP 4. I think the problems of air pollution come from poverty, illiteracy, and urbanization. And that illiteracy, I can tell you with confidence, 8 out of 10 people in Delhi do not understand what is GRAP 4, what are the implications to their, immediate, midterm, and long-term health. So we need bigger steps. We don't need a debate in Parliament. Everybody in Parliament agrees that this is a health emergency. Nobody in Parliament wants to be in Delhi right now. That's how serious this is. So we don't need a debate in Parliament. I'm sorry.
Absolutely, and I must say that you have the liberty to leave the national capital when the AQI turns bad, but many people cannot leave. People work here in the national capital. But meanwhile, thank you, Dr. Vikas Maurya and Jayadar Gupta, for connecting with us and bringing perspective as far as air pollution is concerned. Now, we've been telling you about the measures that have been taken by the government here. The toughest pollution curbs have been put in place by the government. The Commission for Air Quality Management has invoked GRAP Stage 4, which is the highest level under the Graded Response Action Plan. Now, Stage 4 means that maximum restriction will be put in place to cut the emissions, reduce the movement of the vehicles, and limit the human exposure to the toxic air. Schools across the national capital, they have shifted to hybrid classes for students up to class 9th and class 11th. Government offices will be functioning with over 50% of the staff physically present there, and the rest will be working from home. In private offices too, we are learning that they have been directed to limit physical attendance to 50%. Now, with mandatory work from home, that is also put in place, and staggered work hours. So it remains to be seen whether that will solve the issue or not. But most importantly, what we are learning is that all the measures are aimed at cutting the traffic and reducing the exposure. So on paper, yes, the strongest curbs are in place, but on the ground, it remains to be seen whether they will be implemented or not. Because time and again, we see every year that construction and demolition activities activities are banned in the national capital. But despite that, not in the central Delhi, but in and around the area, we still see the construction and demolition activities continue. Have a look at the reactions coming in.
GRAP 4, we know it's and GRAP itself, it's a reactive measure. So we are obviously coming to a situation, such a terrible situation, and the numbers that now GRAP 4 is invoked, rightly so. But there's a larger picture to it. It's what we've done throughout the year or years or many years ago, the decisions that were taken by the policymakers, that we are in this situation. These are not overnight things. We know that there are vehicle emissions, there's construction. Now, even if we, right now for GRAP, all the construction will stop and taking it in the, perfect mode that everything has stopped. So how many days will you do that? We'll see the 2-3 days and the numbers will come back, then it'll be revoked.
Politics has started over this entire matter, even as the people of the national capital are finding it very hard to breathe. The Congress party has chosen to politicize the pollution control measures in the national capital. In the parliament, Rahul Gandhi said it's time to come together to fight pollution crisis in the national capital. But his own party, MP Pramod Tiwari, is questioning the timing of the GRAP for in the national capital. He has claimed that it coincides with the Congress's party's vote chori rally that is going to take place at 12:30 p.m. at Ram Leela Maidan. So this is what the Congress party has said. He has said that the timing of the GRAP 4 implementation is bizarre. Have a look at the reaction.
देखिए, हुस्न इत्तेफाक कि आज ही वोट चोरी पर कांग्रेस की विशाल रैली है रामलीला गांव में। इसकी टाइमिंग का सवाल है, जिससे गाड़ियों को रोका जा सके, बड़ी गाड़ियां ना आ सकें, वो अपनी जगह। पर इसमें कोई दो राय नहीं कि दिल्ली को गैस चैम्बर में तब्दील कर दिया है भारतीय जनता पार्टी की सरकार ने। आम आदमी पार्टी ने नींव रखी और इमारत टनल की, गैस टनल की भाजपा ने बनाई।
All right, so the politics has started over the entire matter, with the Congress MP Pramod Tiwari questioning the timing of the implementation of GRAP 4, claiming that it coincides with the Congress party's vote chori rally that is going to start in just some time in Ram Leela Maidan. For more on this, let me go across to my colleague Kritika, who's been tracking all the details. Kritika, now the politics has started over the entire matter. Take us through the details about what the Congress party has said and the reaction, if any, that is coming from BJP on this.
Well, yes, Akansha, we're seeing that a lot of politics over the rally that is yet to begin is starting. As you can already see, a lot of roads also are witnessing lots of congestion as far as the rally is also concerned. But the politicking over it has also begun. We've also seen Samit Patra also making statements. And more so, what is happening here in Delhi, in this particular AQI also, many stations are at 499 too. That is the situation of the air quality currently in the national capital region. And in such a scenario, the rally will also be taking place, only posing in fact serious risks to the people who will be coming in. Over to you, Kansha.
Absolutely. Keeping the politics aside, let's talk about the situation in the national capital. Coming to you, Shivani, now. We believe you are in central Delhi right now. What is the situation there? Because the AQI has now crossed the 400 mark. It is nearing the 500 mark in the national capital.
Well, Akansha, talking about the numbers game of AQI, then there is an area called Rohini in Delhi that has reached 499 mark of the AQI, which is already almost in hazardous category. Similarly, there are more than 5 such areas. Those are above 492 marks. There are more than a dozen of areas. Those are above 485 mark of AQI. That clearly showcases that this entire national capital is unbreathable for any kind of a strong and healthy human being as well. But right now, since we are in Central Delhi, we're quite close to multiple, hotspots like India Gate that gives gives us a right glimpse of what exactly the air look like right now. You will see around me the visibility is very poor, it is still very low, and of course the most important part, Akanksha, kind of curves that the government is stating that they are taking the action, the major, the GRAP 4, everything could be on paper or visible maybe on the paths of the Delhi, but interestingly none of the people I have seen, those are wearing masks carefully, or people are taking precautions. Sanitization is something that is not taking place. There is only one spot in central Delhi, namely ITO, that has those sprinkles of water air that can be seen. But apart from that, there are no such areas. Those are seeing, the water sprinkles or any sort of measure. There is no protocol with regards to mask wearing. There are people, those are getting admitted to the hospital. The number of such patients are also rising up. Healthy are becoming unhealthy.
Absolutely.
Unhealthy.
So it appears that it is all on paper as far as GRAP 4 measures are concerned, with many also saying if this is too little, too late action by the Delhi government there. Thanks so much, Kritika.